you're receiving this video segment because you have made a good decision to undergo penile prosthesis for the definitive treatment of your erectile dysfunction. I'm Dr. Arnold Bullock, and I'm one of the larger penile implanters in the United States. I'm glad that you have chosen to come into my practice and have elected to undergo this procedure that takes about an hour and a half total time for the surgery. Half the patients do it as an outpatient, and the other half choose to stay overnight. We're sending you this video because it is imperative that you complete a few tasks in order to successfully make it to surgery. We'll send you another video after surgery to give you some help to make sure you follow instructions to have a successful long-term outcome with few complications after the implant surgery. So, things that you could do to ensure that you make it to surgery and that all of the preoperative tasks are completed. So, we try to make it easy. Leona should have sent you a sheet of packet that includes instructions and good detail about all that you need to do. But one of the things that you have to do 1 to 2 weeks before surgery is to meet with the anesthesia team. We want the anesthesiologist to evaluate you and make sure that you really are safe for surgery. They want to go over your medications. They want to do a brief examination. They, if need be, want to look at some of your tests from a cardiologist, for instance, to make sure that this surgery is safe and that you're fit for surgery. During that same visit, typically, we will have you to undergo some blood testing. So specifically, to look and make sure that your blood sugar is under control, to make sure that there's no issues with your body chemistry and your total blood count. Before you can have an implant, you have to drop off a urine so we can have a negative urine culture. That has to be done at least 5 days before surgery, but it's typically done when the blood testing is ordered all at the same time. Now, a COVID test, that test has to be done within 3 days of the surgery. And so all of that's listed in the packet. So anesthesia visit, blood test draws in the lab, urine culture, and a COVID test. Now, what about this urine culture? When you give us a urine specimen for a culture, it's really important that you clean off the head of your penis with the swab that's provided. You let some of the urine go into the toilet, and then midstream, you collect just a little bit of urine, and then let the rest go into the toilet. The first part of the stream is contaminated by your skin, and that's why we want a midstream specimen. Other things that could cause an operation to be canceled last minute is when we find out that a person's been taking a blood thinner. There's a ton of different medications like aspirin that can thin out your blood and would increase the risk of you having a hematoma. And so if you look at that package that Leona sent you, it has a list of medications that you have to be sure you quit taking at least 5 days before surgery. Amazingly, common reason why people have their operation canceled is because they eat and drink after midnight. You can't go to sleep if you have liquid or food in your stomach. So after midnight, you can't eat or drink prior to the operation. There are some people that will refrain from eating or drinking prior to the operation, come and are in the holding area before surgery. They see a coffee machine and they'll have a cup of coffee. And so you can't eat or drink after midnight until after your surgery. As soon as your surgery is over, we'll get you something to eat and drink. We want people to have a successful surgery, and part of that is to reduce the risk of an infection is by cleaning off your wound and taking a shower using a special antibiotic soap beginning 2 days before the surgery. A minor thing, but it's all of these things that we can do to improve your outcomes. just like keeping your blood sugar under control. If you are diabetic, it is very, very important that you monitor your blood sugar very closely for 2 weeks before surgery and for at least a month after the surgery. If a person comes in and their blood sugar is over 220, for the most part, your surgery is going to be canceled. So I don't care what you need to do to refrain from, eating a bad, high-calorie diet before surgery. If you want this surgery, you have to control your blood sugar before. So any other questions, please don't hesitate to call Leona Stokes, my assistant, 314-653-4603. Thank you.